So why has healthcare been such a growing area for organized labor to expand? From home healthcare workers and registered nurses and even doctors, organized labor is finding an important audience in the medical care field. You're listening to the Clinicians Roundtable on ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and joining me today is Keith Kelleher, who is president of SEIU Healthcare of Illinois and Indiana. SEIU is the fifth largest local of the Service Employees International Union, one of the largest labor organizations in the country. SEIU of Illinois and Indiana alone represents more than 85,000 workers in home health, nursing home care, and child care. Mr. Kelleher has been a labor organizer and leader for almost 3 decades and was elected to the vice presidency of the SEIU International Executive Board. Mr. Kelleher joins us from his offices in downtown Chicago. Keith Kelleher, welcome to ReachMD Radio.
Thanks, Bruce. It's good to be here, and I thank you for inviting me.
Great to have you here because we know SEIU is getting a lot of national acclaim because of the celebrity status of one of your big allies, President Obama. But for our listeners who might not be familiar with SEIU, please give us a little background in an era where people are constantly hearing about the auto industry having problems and organized labor not having quite the clout that it did 10 and 20 years ago. In healthcare, that's a different story, isn't it?
Yes, it is, although, again, we would always like to organize more, and we'll be organizing more aggressively in the future. But our union, SEIU, is the largest union in the country with 2.1 million members in 3 separate divisions. One is healthcare, which is our largest, with over 1 million members, anywhere from certified nurses assistants, home healthcare workers, child care providers, all the way up to doctors, nurses, technicians, and folks like that. And then public services is our second largest division, and then our property services division is our third largest division, and that's folks who are service workers in buildings, security guards, sanitation engineers, folks like that. So that's what our membership is, and in our union, SEIU Healthcare Illinois and Indiana, we have 85,000 workers from, again, home health care was about 30,000, hospitals is about 8,000, nursing homes is about 9,000, and about 35,000 child care providers. So we have a good range of workers in all different types and parts of the healthcare industry.
And in the area of organizing, my understanding is that healthcare is one of the fastest growing areas where workers are joining a union. And why is that?
We've been successful here in organizing doctors and organizing a lot of other healthcare workers, too. The doctors specifically, a number of attending physicians within the Cook County healthcare system here in Illinois have organized with the Doctors Council of SEIU, which is working very closely with us in organizing there, as well as with doctors at Oak Forest Hospital, just in the suburbs of Chicago, organized in 2002 and certified and got their union in 2004. Providence Hospital was just certified about a year ago, January 2008. The ACHN Clinic Network and CERMAC Hospital were also, the doctors there also organized in spring of 2008. We have doctors who've organized in New York City through our National Doctors Council and Council of Interns and Residents, and in L.A., and in many of the major cities and healthcare regions of the United States. So thousands of doctors have organized in the last couple of years. For many of the reasons you ask why, well, they're motivated for many of the reasons that other folks are, although it's not just wages, hours, and benefits. You know, people think of a doctor, they think they're making big bucks. Well, that is true in some specialties and in some healthcare. Many physicians are making good money. But like, for instance, the attending physicians at Cook County, they were motivated to organize largely around patient care issues because, like in the bureaucracy of the Cook County healthcare systems, doctors felt that it was critical that they have an independent voice to advocate for the under and uninsured patients who they saw many times getting inadequate care. They just won their first union contract at Cook County in 2008. Attending physicians, the fight to begin organizing began more than 20 years ago, but they were fought by the Cook County government, but were still able to organize and win their first contract. But it's continuing today. We have a majority of the physicians in the Cook County system now. We have attending physicians at Schroeder Hospital. That's the flagship hospital of the county system, and they're still in the fight to organize right now. So we are very active in organizing doctors locally and nationally. One other thing about the physicians at Cook County, just a few years ago, I don't know if you remember this, they laid off a number of physicians throughout the Bureau to do budget cuts. And the county system lost a troubling number of renowned doctors, and that's still fresh in the minds of many Cook County physicians, and it's a real concern. And that spurred folks to organize to protect their positions, but also because it was around the patient care. The layoffs are really hurting patients' care, and the doctors really wanted to ensure in the contract that there was language as far as that patients would get adequate care, and they won. And now the attending physicians and the doctor council are working with the other workers like our CNAs, our technologists, our therapists, and nurses to protect the essential services in the county budget. So those are some of the reasons why not only doctors, but also other healthcare workers organize. As I was saying before, though, we also actually pioneered in organizing what 20 years ago many people never even knew about, which was home health care. And those are folks who go out and take care of seniors, people with disabilities, folks who are recovering from accidents in their homes as opposed to having to be in an institution. Since then, since we began that organizing 25 years ago, SEIU nationally has started organizing here in Chicago as well as in New York, and just those 200 members who organized in Chicago back in 1983 has now grown to about 35,000 members, and nationally, SEIU only had about 40,000 home care workers back in 1980. They now have over 400,000 home care workers who are members of our union now, who have organized and won wage and benefit increases, health care, et cetera. To give you an idea, when we first started organizing in 1983, home care workers made $1 an hour for about 20% of their hours, even though minimum wage was $3.35. Because they were considered independent subcontractors, which a lot of doctors and other health specialists and workers are forced into these independent contractor situations. We were able to get those folks brought up to minimum wage, and now those folks, at the end of this new contract we just signed, will be making around $11.55 an hour, plus will have health insurance, which they did not have before. So those are the kinds of things people can win when they organize together. And the bigger question now is that President Obama has won, is getting into law a lot of the things that have been promised through his change campaign.
I just want to remind our listeners, if you're just joining us or even new to our channel, you're listening to ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and joining me today is Keith Kelleher, who is president of SEIU Healthcare of Illinois and Indiana, which is part of one of the largest unions in the country, if not world, Service Employees International Union, which is organizing a lot of healthcare workers and doctors. And we were just talking about what President Obama, how he's an ally of SEIU. How does his policy fit into what you might be doing going forward?
Well, I think all healthcare professionals and workers will know they're on the front lines every day. Our members deal with the situations where the 50 million people in the United States without health insurance come in the doors of many of the hospitals our members work in every day. So we supported President Obama because of his change campaign to bring into effect health care reform, and economic stimulus, and the Employee Free Choice Act. So health care reform, what we hope to do is bring universal coverage to the over 50 million folks without health insurance now. That's one. The economic stimulus, we want to make sure that that money goes to working families this time instead of the last group of money that went to the financial institutions and bailed those folks out. We think it's time to bail out working families in the United States, and so does President Obama. So we're standing with him to pass the economic stimulus. And the third is the Employee Free Choice Act. That will allow folks to organize on the job without fear of being fired or have to put through campaigns where folks are threatened and are intimidated and things like that. So those are the big things that we're working for and want to see changed, and that's why we're working with President Obama to get these things put into effect.
Well, you mentioned earlier the home health care workers who back in the early 80s were making $1 an hour, and they were considered independent contractors. I know that one of the issues with physicians that they cannot organize is because it's sort of viewed as collective bargaining, price fixing if they were part of a union and negotiated with health insurance companies. And maybe you could talk about that. However, you're seeing lots of stories in Chicago Tribune company publications, other publications about more surgeons and doctor shortages and doctors becoming independent contractors with temp agencies and so forth. Now, could these doctors form a union? How does that all work?
Well, that's what we would like to see happen. We were able to organize politically here and nationally in many states, and folks, hundreds of thousands of workers who had been considered independent subcontractors are now able to be represented under a collective bargaining agreement and have won living wages, health care, and other benefits that are usually denied to independent subcontractors. So you have to change the way the law is sometimes in your state. Sometimes you have to change the way the law is nationally. And we think the Employee Free Choice Act will help folks organize and allow these sort of groups of workers who are now denied the right to organize an ability to organize. You know, this anti-monopoly language that forbids people from organizing, that was the excuse they used, 100 years ago, that nobody should be able to have a union. I mean, it used to be that you couldn't legally have a union because they saw that as anti-competitive. Economists in those days would say, oh, it's anti-competitive, it raises wages, it da-da-da-da-da-da. And some of those things are true, but it hurts full employment. Well, slavery was full employment, and that's not something we want to go back to. We don't want to have conditions where wages are low, there's no benefits. So that's why we're supporting President Obama's campaign and our union's campaign, which is called Change That Works, that we really need change that works for Americans' working families. So that's why we'll be having hundreds of organizers and thousands of our members working to keep accountable the politicians. Many of them signed on. If you look in the House, what was it, 40, 50 new Congress people, and I think it's like 10 or 15 new senators. Many of them pledged to not only our members, but to the American people that they would be for health care reform and for health care for all Americans. They would be for an economic stimulus plan that will lift everybody up instead of keeping everybody down, and employee free choice, which would allow people to organize and not cost the government a dime. So we intend to keep those folks' feet to the fire because they made commitments, and we have very good relationships with them, but you know how it is sometimes. After an election, sometimes people forget who put them in there. And that's the part of the job of our union and other groups across the United States who are going to make sure and remind the congressmen and the senators and the president that these were commitments they made, and we're getting very good response. But, as it gets closer to vote time, sometimes folks get shaky, and we'll be there to help shore them up and support them. So that's what we're fighting for with our Change That Works campaign, is to make sure that we get these things passed that have been promised over the last couple of months. So we're looking forward to it. We think it's an exciting time, and we hope to be a key part in bringing in an economic recovery to America's working families instead of to the millionaires like the last one was.
Well, with that, I'd like to thank Keith Kelleher, who has been our guest. He is the president of SEIU Healthcare of Illinois and Indiana, which is a part of the Service Employees International Union, which our listeners will be hearing a lot more, not only in the healthcare industry, but in the policy debate. We've been talking about organized labor and its growth in the healthcare industry. And I'd like to thank Keith for being our guest. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and you've been listening to ReachMD Radio on XM 160, the channel for medical professionals. Please visit our website at reachmd.com, which features our entire library through on-demand podcasts. Or please also call us toll-free with your comments and suggestions at 888-639-6157. That's 888-639-6157. And I'd like to thank you today for listening.